Hi, I'm Devastation. Thanks for coming to my channel. I'm an internationally board certified lactation consultant, and today I'm going to teach you how to hand express. Hand expression can be really useful in the early days, soon after baby's born, to get out the colostrum, which is that newborn milk that is much thicker and harder to express with a pump. Because it is in smaller amounts, it's just the perfect amount for baby's tiny tummy. And besides in the newborn days, hand expression is a great tool to have if you're struggling with low supply, if your pump quits on you, if you are delayed at getting home and you need some way to remove some milk to maintain your milk supply. So it's really a great tool to have and to know how to do properly. I got my booby ball here. So it's a little bit easier than me, pulling out my own boob to show you. So to hand express, first you're going to start with kind of massaging around the breast. You kind of want to do like rounded, like little circles to massage all the way around. And this is really helpful also if you are engorged in those early days when your milk has just transitioned and you have a ton of it. So you want to kind of work your way all the way around. You'll be able to feel those milk sacs full of milk. It might feel like little marbles in there. So if you have a lot of swelling around the nipple that's kind of flattened it out, first, you're going to need to push that fluid away from the nipple so that the milk can actually flow through easily. So to do that, you kind of want to press back around the nipple, kind of just press gently in and kind of massage that fluid back towards your armpits. And that'll help drain any swelling that's occurred because of IV fluids at birth or, any other issues that might be going on there. So once you have a little bit more shape to the nipple and you feel like, you've got a little bit more, less pressure around the nipple itself, then you can start hand expressing. You can express into a little cup, into a bottle, even into a spoon. Okay, so, and it might be helpful if you have your partner or a nurse or someone like that, if you're in the hospital, to hold a collection device for you so you can really focus on removing the milk. But it is possible to do on your own. It just might be a little bit more tricky. So it's not like milking a cow exactly. You're not going to pull on your nipple. It's not how you would think. And I've seen a lot of people try to hand express that way because that's what you see your pump do, is pull on the nipple, but that's not how it works. So instead, you want to keep your hand in like a cup, a C shape, and go back behind the areola, behind the nipple. And then you want to press in toward your chest. So we're not trying to force milk forward like this. We're pushing in toward the chest and then we're squeezing together with a slight roll forward. So let me see, make sure you can see what I'm doing. You want to push in toward the chest, squeeze gently together, and then roll forward. And it might take a little bit, but you should see some drops of milk start to come out. Once you get the hang of it, it's much easier. You just push in, squeeze together, roll forward, and you're going to work your way all the way around the breast. Make sure you get all those different milk ducts all around. You want to do this on both sides. And if you're just doing this for engorgement, you want to do this just till you're comfortable, till your breast is softer and you can get baby to then latch on if that's how you're feeding, or you can then pump. If you're doing this while weaning and you're feeling engorged, that's a totally great option too. You just want to hand express just enough for comfort because you want that breast to remain full at that point. A fuller breast makes milk more slowly. It tells your body to stop making milk. So keep making milk. You want to empty fully. You want to empty around the clock. An emptier breast makes milk more quickly than a fuller breast. Breast milk contains a protein called the feedback inhibitor of lactation, FIL, And so that's the fill factor. Basically, a fuller breast has more of those proteins to lock into those receptors in the breast to tell your body, slow down, we don't need this much milk. So you want to keep, if you want to continue lactation, you want to remove milk as often as you can, whenever baby is hungry, or on a schedule if you're exclusively pumping. I think that probably covers it. I probably went over more things than I should have. Just to recap, to hand express, you don't want to pull on the nipple. You can do some kind of nipple stimulation at first, especially if you have flattened nipples, or you feel like you need some help with the letdown. You can do some nipple stimulation. You can do some breast massage. I recommend the breast massage, especially if you're feeling engorged or very full. So do that breast massage around there, and then take your little C shape, go behind the areola, press in toward the chest, squeeze together and roll forward. Just really gentle. Press in, squeeze down, roll forward. Press in, squeeze down, roll forward. So you just want to work your way all the way around. Make sure you get all those milk sacs in there, and then you're all set. If you have any questions, please leave them below. And if you have any video ideas, anything that you're concerned about, just let me know, and I will try to make a video to address that soon. Thanks very much. If you like this video or you know someone who could use it, please hit the like button, subscribe, and share with your friends. Thanks very much. Bye.